Hello and welcome to a special hour-long programme answering your questions on Omicron. It has been almost a fortnight since the latest COVID variant was first identified in South Africa. Little's yet known about the heavily mutated strain, but it is perfectly plausible that it's more transmissible and more resistant to our vaccines. This hour, I'm joined by the JCVI's Deputy Chair, Professor Anthony Harnden, by Helen Donovan from the Royal College of Nursing, Genetic Epidemiology Professor Tim Spector, and Professor Robert West, who advises SAGE on behavioural health psychology. Now, throughout the day, we've been getting your questions about Omicron, questions about how virulent it is, whether our jabs are effective, and whether Christmas might be cancelled this year. This is our Omicron variant Q&A. Just how worried should we be?
I'm pretty confident, or absolutely confident, this Christmas will be considerably better than last.
There is no time to delay. It's our opportunity to get ahead.
I just hope we don't go into another lockdown, to be honest.
Given the large number of mutations, it is highly possible that the efficacy of the vaccine, all of them, is going down.
I'm scared of it.
Globally, we have a toxic mix of low vaccine coverage and very low testing.
Our strategy is all about buying time. Have you got boosted yet?
No, I'm 64 and I've still not had it.
I'll walk in with you. Come on, let's do it.
So where are we now? Well, the number of Omicron cases detected in the UK has risen again to 32, with a further 10 in England and Scotland identified. Altogether, at least 23 countries have reported cases, and the WHO expects that number to rise. Early indications show people are experiencing mild symptoms, with further data on the variant in the coming days. Well, let's bring in our panel now. Joining us to begin with, Professor Tim Spector and Professor Robert West. Thank you to both of them. Let's start with our first question then, shall we? From Justin, who has asked just how deadly is Omicron, how transmissible it is, and should we be prepared for a huge wave of cases? Professor Tim Spector, let me put that one to you first.
Well, the real answer is we don't know for sure. We believe that it's probably more transmissible than the current variant, which is Delta, just in the same way that Delta was more transmissible than Alpha. But more than that, we don't know exactly by whether it's 10% more or 50% more. That still remains to be determined. Most people believe that the natural evolution is going to be in that direction. In terms of severity, whether more likely to take you to hospital or not, everything so far looks that it's not likely to be more severe. It'll either be the same or slightly milder than the other variants, the current Delta variant. Again, we're basing this on very small amounts of information, but I think people who are worried about it being a real deadly, fatal variant that transmits wildly, there's no evidence that that's the case at all. So I think so far people shouldn't be over worried about this, not panic about it. And we've gone through this variant transition before, and cases picked up, but actually severity slightly dropped.
And Tim, obviously there's still a lot we don't know about this variant, including really how long it has been circulating for. But if, as some suspect, it's been circulating for longer than we initially thought, why, Steve asks, are we not seeing higher cases or hospitalisations? Why are we worried at all? I mean, South Africa today, Tim, has seen a doubling of cases, but hospitalisations remaining broadly flat there.
Yes. Well, you've got to realise that hospitalisations tend to lag new cases anyway by a couple of weeks. So you don't tend to see the hospitals filling up until the virus has been around for, 2 to 4 weeks. But remember, actually, South Africa has less cases per million than we do in the UK. And most people believe the virus has been around for perhaps, up to 4 weeks and hasn't gone wild everywhere. So in a way, that's somewhat reassuring. And we have to remember also that the UK currently has around 40,000 confirmed cases, or according to our Zoe study, about 80,000 cases. That's remained pretty high. And so for the new variant to take over, it's probably got to displace Delta, and many people have natural immunity from Delta, so it will be harder for it to take over. So I think we are going to see more cases, but I don't see it exploding in perhaps the way it would have done if before we'd been infected with other ones, or before most of the country got vaccinated.
Let's bring in Professor Anthony Harnden, Deputy Chair of the JCVI now, and pick up on that question. That's not Professor Harnden, is it? Let's bring him in. And I want to pick up, Professor Harnden, with you on that question about whether or not this will become the most infectious, whether this will become a dominant variant. We've got a question from Trent from Berlin asking whether it's possible that a more infectious but less deadly COVID-19 variant could have a positive impact. This has been raised by an epidemiologist in Germany, among others, hasn't it? That could a highly transmissible variant with milder symptoms actually bring a more rapid end to the pandemic?
It's possible. I mean, all things are possible. I mean, there's three key things that we don't know about this new variant. One, whether it has a transmission advantage over Delta. Two, whether there is a degree of vaccine escape or not. I think by looking at the mutations on the spike protein, many of which are mutations about antibody reception, it probably has got a degree of vaccine escape. And the third question, which is probably the most important of all, is what sort of disease severity does the variant cause? And that we don't know. So if it causes severe disease, that's hospitalization and deaths, and has vaccine escape, then obviously that's not very good news. But we're hoping really that it doesn't cause severe disease, and that by boosting the immunity of the whole population, by giving them a booster vaccine, they'll have high enough immunity levels to actually be able to partially fight off the infection should they get it and get a mild illness. So lots of uncertainties around the variant, but there's good reason to be optimistic if we get vaccinated.
Well, I was going to ask you, Anthony, about the data that we're working with at the moment, small samples being studied. What do they tell us so far about where we might be heading, and how much more do we need?
Well, all they're telling us so far, because they really are small numbers and it is very early stages, is that this particular variant has a number of mutations on this spike protein, which is the bit that the vaccines target, that cause the mutations which affect the receptor binding antigen, so how it gets into the cell, but also the antibody receiving part of the spike protein. So all the indications so far are that it is of concern, which is why it's been a variant of concern and why we've moved very quickly to accelerate the booster vaccination program.
Professor Tim Spector, I want to talk to you about symptoms, because that's something that you've been studying with the COVID, the Zoe study throughout the course of this pandemic. Shaheen in West London has asked about the kind of symptoms we're seeing with Omicron, suggestions of aches and pains, but no loss of taste and smell. What do we know so far, and what does that mean for our official symptoms list and identifying these cases?
Well, we've had problems with the symptom list for many months now in the UK, because 40% of people who are testing positive in the UK don't have any of the classic symptoms anyway. So this is part of the natural current Delta virus, is that it is a mixture of symptoms, and increasingly with vaccinated people and young people, the picture is much closer to a respiratory virus than the original symptoms we got, which was much more a sort of general malaise all over the body. Most of it is looking like a bad cold for, as I said, about half the people who get it in the UK at the moment. Now, unfortunately, you can't officially still get a PCR test in the UK if you don't have the classic symptoms. So that's why we think 40% of cases are still going missing a lot in the UK. And if we look at the South African data, which is still very limited in terms of numbers, they're suggesting that it is looking like the Zoe picture of the disease, which is more respiratory type of symptoms, more like a cold, and they haven't yet seen loss of taste or smell, but it could just be that they've got very small numbers. Currently, loss of taste or smell is about the number 6 in our symptom list in Delta, and fever is number 7. So with small numbers, you might be missing that. So I think it's too early to say, but we hope that with the Zoe COVID study, people reporting their symptoms, and with the government telling them if they have the new variant or not, we'll very quickly know the answer within a couple of weeks about whether we need to look for new symptoms. But people need to be alert and think if they're unwell, just the possibility that this could be a new variant of COVID that they weren't expecting.
It's difficult, isn't it, in winter with the number of respiratory infections that are circulating. I just want to bring in our science correspondent, Thomas Moore, now, who's here in the studio with me. And Thomas, you've, throughout the day, been taking questions from viewers who've been contacting you through the website and on social media. What are the main burning issues?
I think a lot of people are confused that they're getting such conflicting advice from scientists, some saying that this could be really, really bad, that this has the hallmarks of an extremely dangerous virus, whereas others think that it's going to be okay, that the vaccines should still work, that there are many reports of very mild disease in Africa. And of course, the two aren't necessarily conflicting. Scientists are in a fog, a lack of knowledge, and they're trying to make an educated guess to navigate their way through. Others want to know how they can be tested. How can you tell the difference between Omicron and Delta?
Particularly because you have to self-isolate. If you're a contact of a suspected Omicron case, how do you know? Precisely that. And fortunately, in our favour is the fact that the PCR test can tell the difference, because there's one particular gene that drops out if it's Omicron, and that's going to be the way forward. But there are many others just wanting to know how on earth they can look forward to a wedding or Christmas or any event like that, given the uncertainty, given the fact that we don't know what the government's going to do in 3 weeks' time, whether it needs to ramp up the restrictions still further based on the evidence emerging, not just in South Africa, but in labs around the world. 3 weeks' time, of course, taking us right up to Christmas. Indeed. Thomas is going to be back with us a little bit later on in the programme, but coming up, the UK led the world in rolling out vaccines early and in big numbers. It has one of the best vaccination rates in Europe. But there are fears the new Omicron variant could put a significant dent into that hard-earned protection. Vaccine developers will be looking closely at the new mutations to see what needs to be done. But there is a tempered optimism about what to expect.
There are a lot of unknown things right now. And keep in mind that we have been preparing for something like that for months. Within weeks, I think we will know most of the information that needs to be known, but every day we learn more. So I'm very, very, very confident that this drug works for all known mutations, including the Omicron one. But we are working on follow-up drugs for the eventual case that maybe a resistance is developed.
We believe this virus is highly infectious. We need to get more data to confirm this, but it seems to be much more infectious than Delta, which of course is problematic. And we also believe that it's already present in most countries. Given the large number of mutations, it is highly possible that the efficacy of the vaccine, all of them, is going down. But we need to wait for the data to know if this is true and how much is it going down.
So what can we do about the Omicron variant? Let's put some more of your questions to our panel of experts. Professor Anthony Harnden, to you first. A question from Yasmin from East London. She's asking whether the new variant can evade the vaccines that have already been developed and rolled out. How confident are we that they're going to work?
Well, we just don't know the answer to that question, but we do know that these COVID vaccines that we've administered in this country very successfully, as you've said, are highly effective at preventing severe disease, that's hospitalization and death, amongst those that have been completed their primary course. So we fully expect with boosting that there will be a degree of vaccine protection against this variant, even if it's not complete. The population we really need to worry about the most are those small proportion in this country, but significant numbers that are unvaccinated. And now is the time to come forward and get your vaccination, because there's no doubt that if you're unvaccinated, you are not protected. Whereas if you're vaccinated, you will have some degree of protection against this new variant. And if you're boosted, that protection will be even more.
Well, let's put that issue to Professor Robert West, because I think there's 5 million people in this country who are eligible for a vaccine, Robert, but haven't yet taken up that opportunity. Many will have had a long time to think about it now. How do we target them? How does the government try and persuade them to get the vaccine?
Yeah, well, I mean, there's different groups within that 5 million. There will be a small group. Unfortunately, in this country, it is a small group of people who sort of set their face against vaccination for various reasons. They've believed some of the nonsense that they've heard on social media and so on, or they just start with a particular point of view and there's no shaking that. That's a very small group. Most of the people who haven't been vaccinated yet will be people who are genuinely weighing up the pros and cons, or they would get vaccinated if, for example, it was a bit easier to do so, if, for example, they knew that, because the vaccine does have side effects and they may need to take a day off work or 2 days off work, if that could be made easier for them. So I think there's plenty of scope there for working with those people, understanding why it is that they're not yet taking the vaccine and supporting them and encouraging them to do so. But we do have to remember that the vaccine is not the only thing here. The vaccine will give a serious level of protection, but it certainly won't be the only solution. We need to look at all the other things that we've been talking about. Mask wearing is really important, very effective. Ventilation in indoor spaces, and making sure that you don't unnecessarily put yourself in contact with other people who might be infected.
Well, that leads me on, Tim Spector, to a question from Rex, who asked why we're doing a big push to try and get all adults boosted before a potential Omicron wave. Shouldn't we start with work from home or restrictions on social gatherings?
If your only objective was to suppress an outbreak, that's what probably you would do, yes. And some countries have done that, and across in Europe, and they've had real restrictions. And there are differences between Wales, Scotland, and England in terms of large social gatherings. So it tends to often be a political decision rather than a purely medical one. Politicians are deciding that would be perhaps less popular for them, or that it would have some economic detriments for the country, and they don't want to do this at the moment, or they want to hold it in reserve, thinking that otherwise people would get fatigued by this. So every measure has a small effect, as we've heard. So all of these things, including social mobility, the way just people moving around a lot, visiting other people, have big impacts. So I think if all of us can do a small amount, then we can all reduce the risk and reduce these outbreaks without really disrupting our social lives to any great extent. So, I think it's good that the government has finally started to do things, and certainly many of us have been pushing for them to be a bit more proactive before the new variant came along. But I think we should be looking at some of the restrictions where it don't make a lot of sense, because you need a mask to go in a supermarket, but you don't have to need a mask to go to the theatre or the cinema, where you're sitting next to people for 2 or 3 hours rather than just 5 minutes. So I think that needs to be sorted out, and I think people would accept these kind of measures perhaps more than the government give them credit for. And I think this is probably where we'd be going on moving forward. And of course, working from home, many people have got used to that, and particularly, but also doing lateral flow tests before you go to any large meeting. And that's something that, as we approach Christmas parties and things, people are going to perhaps want to be thinking about, that they should be planning these a bit more carefully. So if you have a cold or you've got a lateral flow positive, you're not going to be mixing with 50 other people.
Let's bring in Helen Donovan now of the Royal College of Nurses. You'll have seen her pop up while Tim was speaking there. Helen, thanks very much indeed for joining us. Let's talk about the vaccine rollout and the capacity that the NHS has for it. Stephen has asked about boosters and jabs. He's had both jabs and a booster. Will he need another vaccine if it is developed? And Nimra Shahid from Southampton has also asked, do I still have to wait 6 months to get a booster? Because me and others have been turned away from vaccination centres for coming too early. I know you're not responsible for the specifics on it, but in terms of the policy, when can people get those vaccines? What are the priorities?
Well, so in answer to the first question, I think, we don't know whether we're going to need further booster doses and further vaccines as time goes on. But right from the beginning of the vaccine programme for COVID-19, we've had the suggestion that may well be a possibility. So I think in answer to the first question, it's highly likely, but, the evidence is still coming through and we will still have to wait and see. I think in terms of when people should come forward, I think it's still really clear that we need to make sure that the elderly and people with underlying health conditions get the vaccine as soon as possible, and they need to be prioritised. And yes, the guidance has changed, so we can start giving people booster doses after 3 months. But obviously, those processes and the sort of operational side of that is coming through. So I think there is a need to still be a little bit patient. It will be coming through in the next few weeks. And obviously, we want people to turn up. We want people to access the services as they come through. But as we know, the NHS system and the vaccine programme itself is really now ramping up the capacity. And, that alongside all of the other things that the health and care system need to do. So I think, in relation to what other speakers have said about we all need to do our part, I think there's an element of just, go with it and make sure that we still.
I think we're losing you there.
Vaccinate those people who are still on offer. The evergreen offer is still there.
So
sorry.
Priority on, we're slightly losing your line, but a priority on those who haven't yet taken up the offer of a vaccine, getting those through and getting the over 40s their boosters, and then working down through the age ranges. I wonder then if I can bring you back in, Robert West, and as the government pushes harder and harder for people to get jabbed and to get boosted, are we in danger of creating a two-tier society, the haves and the have-nots, and how we deal with that?
There is a risk. I think that, there are demographic differences between, people who are more or less likely to get the vaccine, but actually they're not that great. And I think it's more a question of addressing the specific concerns that some people have about the vaccine, rather than worrying too much about whole sectors of society. But on the other hand, I do agree with you that we already have a two-tier or multi-tier system in this country in terms of the impact that COVID has had and that the restrictions have had. And one of the problems that we faced is that, to be fair, I don't really think that the government has done enough to compensate people who've had their lives completely disrupted or would have their lives disrupted if they had to self-isolate. One of the big weaknesses in the chain of events that needs to happen to protect people is a failure to make sure that people have the support that they need if they need to self-isolate. And that's something that still needs to be addressed. But I think, overall, what we're looking at going forward is individuals, government, and all members of society taking responsibility, all of us taking responsibility to do the little bits that we can to protect ourselves and other people. Mask wearing, ventilation, social distancing where we can, working at home where we can, and just, treating it like a sort of, we would in road safety. You don't cross the road without looking both ways. It's a risk management exercise, and our job is to keep our risk as low as we can possibly get it.
Just one very brief final thought from you, Robert, on this. David Davis described it today as a biological arms race over vaccines. How much tolerance do you think the public have to keep on being jabbed if this is the way we are heading?
Yeah, they will do it. I mean, people are not stupid, and you do what you have to. All of us. Life throws brickbats at us, and we say, well, okay, this is where we are. This is what we have to do. And what's really been so interesting over the course of the pandemic is how far the public has actually, if anything, been ahead of the government in terms of saying, this is what we need to do to keep ourselves safe, and then the government has sort of caught up with them. So I think as long as the government doesn't sort of mess it up in terms of communications, I think there's every reason to believe that people will just do what they have to do.
OK, we're going to take a short break. The panel staying with us because coming up next on Sky News, despite global efforts to roll out vaccines, we'll be asking, where did Omicron come from and is it here to stay?
This virus has demonstrated that it will not simply disappear. How many more lives and livelihoods it takes is up to us.
Welcome back to our special programme, answering all your questions about the new Omicron COVID variant. I'm joined by a panel of medical and scientific experts to do just that. Now, Omicron was first identified in South Africa and the alarm was raised to the World Health Organization last Thursday. It sparked a global race to try to contain it, with many countries banning entries from several southern African nations. While many wealthy countries enjoy strong vaccination rates, there are concerns that lower rates in the developing world will only prolong the pandemic.
Globally, we have a toxic mix of low vaccine coverage and very low testing, a recipe for breeding and amplifying variants. That's why we continue to urge countries to fully fund the ACT Accelerator to ensure equitable access to vaccines, tests, therapeutics all over the world. This virus has demonstrated that it will not simply disappear. How many more lives and livelihoods it takes is up to us. Ending the pandemic is not a matter of chance. It is a matter of choice.
So how did we get here? A question sent in for you, Professor Tim Spector, asking how this happened, how did Omicron emerge, and why is it overtaking the Delta variant, if indeed it is?
Well, we don't know, is the answer. We're trying to piece it together from the very astute surveillance of the South African genetics teams that picked it up before any other country. And we don't even know it came from South Africa or Botswana, where those first cases were picked up. We'll probably find some stored samples somewhere where it was around before then. But most people believe it is somewhere in the African area just because of the density of cases. But some of these cases in Europe look as if they've been around for several weeks. And that's a bit of a mystery. So we don't know for sure whether it's going to outcompete Delta either. And it's very unclear from the South African data whether that's true. We do know from some of the cases that we're seeing from Israel that some cases of people with actually boosters have also got the disease, but they've got it very mildly. And I think that's about all we know at the moment. So no one really knows. These these variations could have arisen in a single patient, say he was immunocompromised, had it for maybe weeks, or it could have just been a consequence of countries like the UK in the last 3 months that have had high levels of cases and many chances for viruses to fight against vaccinated people and develop these mutations to help it reproduce and survive. So we really don't know. It's all guesswork at the moment. And we likely will never really find out where case 0 came from.
We have got, though, Tim Spector, haven't we, this interesting situation in the Hong Kong quarantine facility where we've got 2 cases in separate quarantine rooms that have emerged. What does that tell us potentially about the spread of this variant?
Well, it confirms what I was saying, that it's been around for several weeks, and that it's pretty widespread. So it's airline international travel has spread this virus around, and it's hard to know which direction it actually came from originally. And I think we've got to keep an open mind on this and not necessarily blame South Africa or these other African countries for producing the variant. I think that's very counterproductive. And if we do that, it'll mean no one wants to discover a new variant in case they get shunned internationally. So,
and that was a point being made by the World Health Organization today, wasn't it? We mustn't penalise countries for sequencing and identifying and alerting the world to the presence of these variants. A question for you, Professor Anthony Harnden, which has been sent in. Did Omicron really emerge because we didn't share our vaccines with the developing world? I mean, the issue of vaccine equity or inequality is a really big one that we haven't yet resolved.
Well, of course, the UK is one of the biggest contributors internationally to the vaccine stock. I mean, there are a number of problems in, particularly in African countries. It's not just supply that's the issue. There's access to vaccines, and that's quite different. Actually, it's quite difficult to get people to the vaccination centres. And then there is hesitancy in many African countries about the vaccinations and myths and about side effects, etc. So there are a lot of things that we need to get right. But yet the presumption of your question is right. I mean, we're not going to be safe until the whole world has access to vaccines, and we do want to vaccinate the world. I think that's really, really important. And so what you're saying is true. I think we need to both look after our UK population, which I'm responsible for, but we also need to be generous donators, given that we're a developed and relatively wealthy country to other nations. And I'm sure our government will continue to do so.
Robert West, a question from Benji in northwest London, asking if this is something we're going to have to get used to, or we're going to see a new variant that causes changes to our lives every winter. And I suppose a supplementary to that is, how willing are we to make those changes?
When this all started, it was widely believed by the experts, because of the nature of the virus, that we were in this for the long haul, that there would be variants. They would come out on a fairly regular basis, because it's unpredictable, but to expect that. If we were able to develop vaccines, and it's fantastic that we've been able to develop vaccines that have had a high level of effectiveness, but they're not 100% effective. So if we were able to develop them, we knew that wouldn't be the complete solution. So right from the beginning, those who know about these things were saying, we're going to have to make adjustments in the long term. We don't know how long for. The word indefinitely sort of sounds rather painful, but the reality is for the foreseeable future. And those adjustments don't need to be restrictions of the sort, not lockdowns and things like that. They need to be the kind of adjustments to our lives that we do for health and safety, to keep ourselves safe on the roads, to stop ourselves getting infections when we go into hospital and so on. And this is another risk that we have to manage, and that's what we're going to have to do, and we just have to get used to that. So it doesn't have to be horrible for us, but we do have to take it seriously. And to be honest, we know that people do adapt, and people will, over time, we will find that we, have ways of dealing with these things that means that we can get on with our lives.
It's incredible how much we have already adapted. If you could have told us 2 years ago where we'd be today. I just want to bring in...
but it's still tough. There's no doubt about it.
It is indeed. Let's bring in Thomas Moore, who's back in the studio with us. And Thomas, we say you've been answering questions online all day from people coming in. But what are the big questions for you that remain to be answered over the coming weeks?
Look, I mean, we all want
Too
to
many.
know... Well, it's three key questions, really. Is it more transmissible? Does it cause more severe symptoms? Does it evade the vaccine? It's those three questions that they are racing to try and answer, because it will determine our future. Are we going backwards, or can we continue as we are? Everything hinges on those questions, and it's by no means certain that what looks really bad on paper turns out to be quite so bad in reality. It could be that this is a much milder symptom, a virus with much milder symptoms, in which case it won't lead to lots more hospitalizations. And even if the vaccines don't prevent all infections, they might still prevent the serious ones, the ones that put people in hospital and might even result in them dying. And that would be good news. And we won't know until we can actually test the virus against the vaccines.
So not time to panic yet, but as you were describing earlier to us, of course, it's very difficult because of the conflicting messages we've been having from the government, from the scientists.
We are in a knowledge fog, and that is the problem. We're all trying to look at that map of mutations, trying to judge whether there are any clues from those mutations when they've arisen in previous variants that might mean that this is going to turn out to be really bad. But it's not just the number of mutations, it's how they work together that will determine how fit this variant really is, whether it stands up to the vaccines, the high level immunity that we now have built up over the previous 20 months of this pandemic.
Thomas, thank you. Welcome back to our special Q&A on the new Omicron COVID variant. Now, the big question for our panel of experts, and this has come in from so many people, as you can imagine, asking, will Christmas be cancelled this year? I'm going to put this to each of you, and I'm going to start with you, Helen Donovan from the Royal College of Nursing. The big concern is whether the NHS can cope, whether the NHS will be overwhelmed. And I guess at the moment, it wouldn't take that much, would it, for the NHS to be overwhelmed? How confident are you about Christmas?
Well, I think, thank you very much for asking me first, really. It's the big question, isn't it? I think everybody wants to make sure that we have some sort of Christmas, but you're right, the NHS is under huge pressure, as are other healthcare services. So I think going back to some of the responses to other questions, what we all need to do is to do our part to try and keep ahead of the curve, if you like. So vaccination being one part, but also wearing face coverings, trying to make sure that you keep in well-ventilated spaces. This virus is spread by aerosols, so we want to make sure that we minimise the risk of transmission. And I think all of these measures that we're talking about are all part and parcel of the overall aim to make sure that we can not just have Christmas, but, as the previous speaker was saying, get on with our lives, because that's really important for all sorts of things, our mental health, wider healthcare, but just generally living. So I think the message must be get your vaccines, but also make sure that you take the other precautions that we've been talking about, wearing face coverings, making sure that you keep social distancing as far as possible, and take sensible precautions. Just, it's a risk balance, isn't it, all the time?
Yeah, Anthony Harnden, we had Dr. Jenny Harries yesterday suggesting people should restrict their socialising around Christmas. And then we had Boris Johnson, the Prime Minister, and the government saying, well, Christmas can go ahead. The aim is to get ahead of this variant, isn't it, with the booster programme? But is that going to be enough?
Well, the vaccines can do a lot of the heavy lifting, Sarah. I mean, can I just say, I do think, you ought to do this programme in 2 weeks' time when we know a little bit more about this virus, because
we will.
See that there's so many uncertainties. But we're all pretty fed up at this pandemic. We had Christmas last year when a couple of our children weren't allowed to come home and we really don't want that anymore. So I feel more positive. I think these vaccines are very good. If people step up in order in terms of vulnerability, get vaccinated with the booster, and are sensible with their precautions, that social distancing and mask wearing and I mean, it's cold out there, isn't it? So ventilation is quite difficult. But if people are sensible, then I don't see any reason why we can't all enjoy Christmas again, unless this variant takes a real turn for the worse. And we're really not going to know that for a couple of weeks. So have this programme in a couple of weeks, and I'll tell you whether we're going to have Christmas or not. But I sincerely hope so.
By which point we'll have bought the turkey, we'll have all the trimmings, the fridge and the freezer will be full, won't it, Anthony?
Yeah, well, look, we're going to have Christmas anyway, aren't we? We're all going to enjoy it. What we want to do is enjoy with our close family members, and that's the key, really, isn't it? So don't stop buying your turkeys and things, because you will have a Christmas indoors, I'm sure. But let's just hope that we can enjoy it with other family members.
Yeah, and Robert, to you, I mean, at the moment we're told that lockdowns are not on the table. Christmas is going ahead, but if it does come to that, what do you think at this stage in the pandemic compliance would be like? What does the modelling tell you about public tolerance for further restrictions?
Well, it's always hard to predict 100% what people are going to do in the future. But if the past predicts the future, which it usually does, then if it were to come to that, then the public compliance would be high, quite likely. But I want to say that it's worth bearing in mind that we currently have around 1,000 deaths a week from COVID without the variant, and there's no sign now that we're seeing any kind of decline in that, because we've sort of reached not an equilibrium. It goes up and it goes down and so on, but the situation absent of the variant is still pretty dire, and the NHS is in real trouble. So regardless of whether this variant turns out to be worse or better or the same as is expected, we all have to do what we need to do in order to keep infection rates as low as we can make them indefinitely. What I would say about Christmas is that, or the holiday, because Christmas isn't the only holiday that, of course, people in this country celebrate at that time, is I personally wouldn't make plans that involve gatherings that can't be changed. In other words, keep flexible, make your plans, by all means, as I am, but do it in a way which means that should the worst come to the worst, and we have to make sure that people stay apart from each other as much as possible as is safe, then you can still enjoy the holiday period.
Yeah, I mean, that sounds a bit like déjà vu, doesn't it? Those plans and then cancelling those plans, adapting those plans. Tim Spector, and Nadia in West London has asked, along with many others, is another lockdown in the new year inevitable? So perhaps we won't have as much information as we need right before Christmas, but afterwards, what do you think might happen?
Yeah, well, looking at the data on the new cases from the Zoe app, they're fairly steady, although admissions are slightly down, and so we're not seeing the severe cases. So I don't think anything's likely to suddenly kick off in the next 3 weeks. But I do worry that if we're not more careful, or at least we're not as prudent, as we should be, there will be a pickup in the new year. And I think that's really more the question here. And that's going to very much depend on whether Delta fizzles out, because it's basically infected most of the population, or the new variant is going to take over or infect people that have no longer have immunity because they were infected with a different virus or vaccine waning. So I'm more worried about January than December. But I'm hopeful we won't have lockdowns, because I think there isn't a lot of public appetite for it. What I think we're doing is doing everything possible to avoid lockdowns, and we're still not doing that yet in this country. We're still very reluctant to stop very large indoor gatherings, etc. And people just need to be more sensible and start using these lateral flow tests and getting boosters in the next few weeks, which is the thing that everyone can do for the most vulnerable.
I'm just going to come, we've only got 30 seconds left, but Professor Anthony Harnden, a final word from you on what we can all do to give ourselves the best possible hope of getting through this.
Well, stay calm, don't panic, get vaccinated, and try and be optimistic, because I think that if you can do all those things and be sensible with your lifestyle, then I think then we'll get through this. We will get through this as a country. I'm absolutely sure.
Thank you very much indeed. And ending on a note of optimism, which is what we like to see, Professor Anthony Harnden, JCVI's Deputy Chair, Helen Donovan of the Royal College of Nursing, Tim Spector, Genetic Epidemiology Professor, and Professor Robert West, who advises SAGE on behavioural issues. Thank you very much indeed for answering our questions here on Sky News. And we will return to this as we get more information about Omicron. Coming up in the next hour, warnings that the number of people waiting for hospital